I'm Marco Giovanelli. I'm one of the intensive care consultants here in Derby, and my job is working on the intensive care unit and looking after the critically ill patients that come into intensive care in Derby. As part of my role, I'm also the clinical lead for organ donation, along with Janet Watson, our chairman, Louise Hubner is our specialist nurse for organ donation, and we've been involved with setting up the project for the community liaison officer, Kirit Mistry, that we've now appointed over the last 18 months. So as a consultant in intensive care in Derby, the primary role is to make patients better, those that have become critically unwell and required support of their heart, their lungs, their kidneys, their livers, and to get them better. I don't have any role in the organ transplantation side of the NHS blood and transplant team. Our role is purely to look after the patients that are on our intensive care unit in Derby and try and do the best for them. It's only at the point where either a patient has been declared brain dead, or if ongoing treatment on the intensive care unit is no longer in a patient's interests and it's not going to be beneficial to them. So somebody who's not responding to therapy, who is deteriorating despite all that we're doing, it's only then, at the point where we don't feel we can do any more benefit for them, that we talk to the families and consider the patients for organ donation.
So when the intensive care medical staff inform us that a patient has reached the end of the line with regard to treatment options, then we will think about whether the patient has registered themselves as an organ donor, and we would look at the organ donor register on the national database. Along with that, we would plan an approach with the medical team to talk to the family about what the wishes of the individual were. Well, we would meet with the family away from the bedside usually, apart from in the cases of children, but we'd meet with the family away from the bedside, explain and ask them to explain in their own words about what they understand about what's happened to their relative, so that we're sure that they appreciate the situation that their relative is in. And once we've established that they understand, then we would ask them about what they think about organ donation for their relative. And if we know that their relative has registered a wish at that point, we would make that known to the family so that they can think about that as well, to try and uphold the wishes of their relative. If a family say yes to organ donation, then it's our responsibility to try and make that happen and to get something positive out of a usually very devastating situation. So we would try and match up the organs with as many people as possible to make sure that life-saving transplants occur. If the family say no, then our care doesn't stop there. We would still help them through that process until the patient is taken from the intensive care unit to the chapel of rest. So if a family find it very difficult to consent to organ donation, then we would talk to them about the reasons why that might be and help them through that difficult process. If a family believe that organ donation isn't something that they'd like to do, then we'll support them through that. That individual doesn't have to become a donor, but families often try and uphold the wishes of their loved one in such times as those. So organ donation doesn't alter any funeral arrangements or any timings of when the body can be released from the hospital. In fact, it's just the same for any other patient who's within the hospital. Around 500,000 people die every year, and of those people, about 5,000 will be in a position to be able to donate organs for transplant. So it's around 1% of all deaths nationally. So every single organ donor does count because of obviously the number of people waiting for transplants is so high. We know that the BAME donors nationally make up 5% of the organ donors that we have. Yet we know that they make up about 30% on the waiting list, and that's especially prevalent in Derby. It's really important that people from the BAME community come forward to register themselves as an organ donor, because we know that those individuals waiting will have a far better success with a transplant if it comes from someone who is genetically matched a little bit closer.